Hello, this is Josh Alston here once again. We're going over a different assignment for MFT6102 with North Central University. Wanted to go into, it looks like we're going into depressive disorders, anxiety disorders, obsessive compulsive, and related disorders. So this week's assignment was given the assignment to focus on one of those different disorders, and they gave us a character, or not a character, but a live person, but they created a video based on this live person. In this case, I chose to base my assignment this week on The Aviator, which follows the life of Howard Hughes. And so I wanted to talk a little bit about that, so that's where I'm going to go with it. And so just giving the background, the story, Howard Hughes Jr. Was an American entrepreneur, known during his life as one of the most financially successful individuals in the world, first making his name for himself as a film producer. He then became an influential figure in the aviation industry. Later in life, he became known as an eccentric behavior and reclusive lifestyle, which he caused in part to be worsened his obsessive compulsive disorder, which we'll talk about, and chronic pain from the plane crash that he was involved in. As a maverick film tycoon, Hughes gained prominence in Hollywood from the late 1920s, making big budget and often controversial films like The Racket, Hell's Angels, Scarface, and The Outlaw. Hughes formed the Hughes Aircraft Company in 1932, hiring numerous engineers and designers. He spent the rest of the 1930s setting multiple world airspeed records and building the Hughes H-1 Racer and the H-4 Hercules, or better known as the Spruce Goose. He acquired and expanded Trans World Airlines, TWA, and later acquired Air West, renaming it Hughes Air West. Hughes was included in Fly magazine's list of the 51 heroes of aviation, ranked at number 25 today. His legacy is maintained through the Howard Hughes Medical Institute. So it's a little bit about him and his story. Like I said, we're talking about depressive disorders, anxiety disorders, obsessive compulsive, and related disorders. So I wanted to talk a little bit about each one of those and see if any of those were part of Howard Hughes, or I could rule out in those cases. The first one is depressive disorders. Definition of depressive disorders include disruptive mood, dysregulation disorder, major depressive disorder, including major depressive episodes, persistent depressive disorder, premenstrual dysphobic disorder, and I'm probably going to butcher all these fancy words, substance medication-induced depressive disorder due to another medical condition, other specified depressive disorder, and unspecified depressive disorder. Major depressive disorder represents the classic condition in this group of disorders. It is characterized by discrete episodes of at least 2 weeks duration, although most episodes last considerably longer, involving clear-cut changes in affect, cognition, and neurovegetative functions, and inter-episode remissions. A diagnostic based on a single episode is possible, although the disorder is a recurrent one in the majority of the cases. Looking at this and watching The Aviator, I definitely noticed depressive tendencies and different times that you could see that he was definitely depressed, and as things went upon. So at first, if you look at it without knowing the fact that he had OCD, as we're going to talk about in a little bit, you could see the depression was there, but I don't know necessarily if I could put it as a disorder. And so I ruled out, because I believe that the stem of the depression was more from the obsessive compulsive disorder. And so at this point, I put yes, but also I ruled it out after looking at the OCD as more of the symptoms of depression because of that. Next one is anxiety disorder. Anxiety disorders include disorders that share features of excessive fear and anxiety and related behavioral disturbances. Fear is an emotional response to real or perceived imminent threat, whereas anxiety is anticipation of the future threat. Obviously, these two states overlap, but they also differ, with fear more often associated with surges of arousal necessary for fight or flight, thoughts of imminent danger, and escape behavior, and anxiety more often associated with muscle tension and vigilance in preparation for future danger and caution or avoidance of behavior. Sometimes the level of fear or anxiety is reduced by the pervasive avoidance behaviors. Panic attacks feature prominently within the anxiety disorders as a particular type of fear response. Panic attacks are not limited to anxiety disorders, but rather can be seen in other mental disorders as well. The anxiety disorders differs from one another in the types of objects or situations that induce fear, anxiety, or avoidance behavior, and the associated cognitive ideation. Thus, while the anxiety disorder tends to be highly comorbid with each other, they can be differentiated by close examination of the types of stimulus that are feared or avoided in the context and associated thoughts or belief. For example, there's generalized anxiety disorders, paranoid and panic disorders, agoraphobia, conduct disorder, social anxiety disorder, post-traumatic stress disorder, illness, anxiety disorder, depressive or bipolar disorder, opposition defiance disorder, psychotic disorder, and personality disorder. So there's different things that affect the anxiety, and so it's not necessarily pinpointed in the certain areas. When looking at the Aviator with Howard Hughes, in the same regard that we'll talk about a little bit about the OCD, that a lot of the anxiety, I believe, came from that, but a part of that, I believe he definitely did have anxiety disorder that goes along with the OCD that he showed, just because of the simple fact that he was paranoid, or certain things in this business created a certain anxiety, of fear that people were watching him, people were out to get him, and still has different things. So, like I said, yes, I could definitely see that, but as we're going to talk about, the obsessive compulsive was definitely the major disorder that he had, and so I imagine anxiety played along with that as well. Jumping now into OCD, or obsessive compulsive and related disorders. Obsessive compulsive and related disorders include obsessive compulsive disorder, OCD, body dysmorphic disorder, hoarding disorder, hair pulling disorder, skin picking disorder, substance medication induced obsessive compulsive and related disorder, obsessive compulsive and related disorder due to another medical condition, and other specified obsessive compulsive or related disorder, and unspecified obsessive compulsive and related disorder, body functioning related repetitive behavior disorder, obsessional jealousy. There's a lot of words in there. Jumping into the more of a definition, the OCD is characterized by the presence of obsessions and or compulsions, and obsessions are defined by one and two things: recurrent and persistent thoughts, urges, or images that are experienced at sometimes during the disturbance as intrusive and unwanted, and that the most individual cause marks anxiety or distress. The individual attempts to ignore or suppress these thoughts, urges, or images, or to neutralize them with some or other thoughts or actions, i.e., for example, by performing the compulsion. Compulsions are defined by repetitive behaviors, for example, hand washing, ordering, checking, or mental acts like praying, counting, repeating words silently, that the individual feels driven to perform in response to an obsession, or according to the rules that must be applied rigorously. The behavior or mental acts are aimed at preventing or reducing anxiety or distress, or preventing some dread event or situation. However, these behaviors or mental acts are not connected in a realistic way with what they are designed to neutralize or prevent. or are clearly excessive. And so in this regard, when learning about obsessive compulsive disorder, this is something that definitely jumps out as how Howard Hughes was definitely going through. And that's something I think in The Aviator, that's what they wanted you to try to get a glimpse of what that disorder brings with it. At one time, just going through the different things that I noticed through the video that jumped out in regards to showing off this disease compared to anxiety or compared to just a paranoia. He talks about the idea of milk had to have a bottle. It had to be in a bottle, had to be in the cap, had to be still on. So there's specific things that he had. An example, he had a plate that he always had the usual. His usual was steak with a certain amount of peas, certain size peas in a certain order. And at that one point, one of his friends took one pea off of the plate, and that ruined the whole plate for him. He had cellophane on the wheels of the plane, and he made the comment, "Do you have any idea the crap people have on their hands?" And talks about, he talks about, I get these crazy ideas of things that may not be there. So talk about that idea of the thoughts and the urges and images that talks about in the idea of being obsessive. So it brings that out. He says sometimes I truly feel like I'm losing my mind. And so that adds into that diagnosis of obsessive. He had the moments when he was asked, as he was washing his hands so vigorously that he started to bleed, that a man was trying to ask him for a towel. And he couldn't physically get himself to grab that towel, and he said, "I really can't do that." And it's one of those things we'll talk about in just a second, but it's that idea that some people look at this as rude. Some people look at like how selfish is he to not be able to help somebody else out. And I think that's another thing that they would have to struggle with, is that idea that they're trying to control this thing that they can't control. And it makes it the disorder that brings out the fact that it's a disorder. It's not just a choice. It's something that is controlling them beyond their own control. And I think that's something that bothers them. But we'll talk about that in a little bit. The moment when there was a speck on a man's suit, and he couldn't carry on a conversation with that man until he removed the object. After a breakup, he burned all his clothes. He talked about being paranoid. Like, are you recording this message? Is somebody recording this? And the fact that he couldn't open the door because he ran out of cloth, and he couldn't touch the doorknob because of the fact that it could have been so dirty and didn't know what germs on there. And multiple times it would show him repeating words, even to the point where sometimes he had to put his hand over his mouth just because he couldn't stop himself from repeating the words because he didn't want everybody to know. So it's definitely in regards to Howard Hughes, this is definitely a case and a story about a man who struggles with obsessive compulsive disorder, the OCD. And I think they do a very good job. You could definitely feel what the person was going through, what Howard Hughes would have gone through. I mean, to the nth degree, the fact that this showed just a bare minimum of what he had to go through in his life, and it just shows how much of a more amazing person that he is because of the things that he had to go through. One of the things of the assignment wanted us to go on and focus on a treatment plan and focus on the idea of 4 different areas that we could focus on and helping people in these areas to find treatment, to find a way to cope or to help with this disorder. One of the first areas is the pharmacological treatments, and of course that's medication, drugs. And it says that so far the most effective medications for improving OCD symptoms, and I'm going to probably butcher these words, are the the SRI. We'll get SRI. You can look up what that means. It gives a few examples of a chlomorphamine and the selective serotonergic and SSRI. Like I said, these words are somebody definitely scientific had to make them up. And includes different like I said, new drugs on the market. Although the clomipramine has been the most extensive studied drug in the OCD. So basically there's a few different drugs out there that have been formulated for people that have been going through OCD. One thing I noticed, and I was looking at online, I found an article it was done back in 2004 by an Alexander Bysinski, named the current pharmacological treatments of obsessive compulsive disorder. Looking through the one thing that's jumped out to me was this. He said it is important to be aware that the specific difficulties of the pharmacological management of OCD patients. Treatment of an OCD patient is often difficult because of the specific attitude this population is about taking medication. OCD patients, by their nature of the illness, have an inflated need for control and are suspicious and doubtful. Taking medication presents these patients with a sensation of loss of control. That's interesting. Both a patient and a psychopharmacologist need to pay attention to the feelings and to be able to assure compliance. On the other hand, some patients in OCD are prone to develop a magical thinking towards a medication and believe that a particular medication may cure them, only to become disappointed later on. Early discussion of realistic expectations regarding the effectiveness of the medication will help to solve this problem. Another problem that may occur with the population is that medication may become a part of the patient's ritual. Some patients can take medication only on certain days, or a certain number of pills, or they feel are associated with the color, name, or chemical purity of the pill. So it adds to the complexity of having a person with this disorder take certain pills. And that's something I would definitely want to work with a doctor on. But I found that interesting, the idea that there are drugs that can be taken, there are drugs that have helped and been studied, but sometimes even the best drug might not be taken by somebody with OCD just because they cannot control, they can't get it into a ritual in their life. The next area of treatment is the psychological treatment. One of the areas they talk about is behavior treatments. Obsession provokes discomfort, whereas compulsion reduces it. This conceptualized of OCD led to the development of behavioral treatment methods that include prolonged exposure to feared obsessions and prevented the rituals method developed in the late 1960s and early 1970s. Exposure is designed to reduce the negative emotions provoked by the obsessive using the gradual hierarchy in increasingly feared situations. This process is similar to helping a person overcome his or her fear of dogs, or are coming closer and closer to increasing larger and more active animals. At the same time exposure is occurring, all behavior and mental compulsion, as well as the form of naturalization, undoing, or avoidance and obsession, are preventing, again, usually in a gradual fashion. So that's one way they talk about the idea of just changing behavior treatment to help person change what it is that it might be the reason that they started doing something, or they have created a compulsion in order to deal with that phobia or different things that help that way. Another way of psychological treatment is cognitive behavioral therapy. In the short term, cognitive behavioral therapy is a short-term goal-oriented treatment that takes hand-on practical approach in problem solving. Its goal is to change patterns of thinking or behavior that are behind people's difficulties, and so changing the way that they feel. So basically kind of in the same way with behavioral treatments is that idea of changing little by little the way that the person perceives a certain aspect of their life. And so that's been known to help in the treatment in that area. Jumping to the third area of treatment is the family therapy-based treatment. And family therapy-based treatment has, similarities to the psychological treatment, but it focuses on using the family as a whole and the whole system to be able to help the person deal with their diagnosis or find symptoms that they can help treat in a certain way. It goes along the same way, like I said, it talked about behavioral family treatment. Several studies have examined inclusion of family members in treating for OCD. Family members and patients both tend to benefit from family members participating in the psychoeducational groups, especially when patients are concurrently in a behavioral treatment. So basically, taking that behavioral process, that idea of changing something that has occurred or that's occurring that's creating more of the use of the compulsion that the OCD person has, and involving it as a family, working, because sometimes some things that other people do affect that OCD. Just for example, in the story of the aviator with Howard Hughes, when the friend, not knowing that he threw off Howard Hughes's groove, if you want to say, took one of those peas just to take a bite. For him, it was nothing, but for Howard Hughes, it was had a huge effect on him. So, in that case, if friends and family, the system in which Howard Hughes works, if they knew how to deal with him and how to help him in that area, they will not be part of the triggers, or they'll help to maybe change the way that it is perceived too. So that's a huge thing, and that brings into another part with the family therapy based treatment. Is something I've looked in and learned about in the past is the emotional focus therapy, and it just kind of brings that idea of emotional focus therapy believes that all humans have the need for secure relationships in every aspect and across all time frames of their life. It's that idea that you're emotionally bonded, and I think as a family and as a system, you can create that way that the person can have somebody that they can trust and have somebody that they can rely on, and so that their OCD doesn't get flared up by the unknown, or the anxiety or the fear that may be associated with different things. So the emotionally focused therapy would be an interesting treatment to be able to help somebody to draw emotions or take emotion out of certain things or replace it with a better emotion. Last area of treatment is the biomedical treatment, and this is part to do with brain stimulation. Brain stimulation therapy can play a role in treating certain mental disorders. Brain stimulation therapy involves activating or inhibiting the brain's directly with electricity. The electricity can be given directly by electrodes implanted in the brain or non-invasively through electrodes placed on the scalp. The electricity can also be induced by using magnetic fields applied to the head. While these types of therapies are less frequently used than medication or psychotherapies, they hold promise for treating certain mental disorders that do not respond to other treatments. Certain types of brain stimulation therapy talks about, vagus nerve stimulation, repetitive transcranial magnetic stimulation, magnetic seizure therapy, and deep brain stimulation. Basically, it's the idea that you're using the brain, and you're trying to focus not scientifically, but in a way that electrically, to use those same way that you're trying to mentally change the patterns, that when something happens, they're compulsive and they brings on the certain things that they've created in their mind in order to adapt to what's happening. So if you can create a stimuli through the scalp or through the brain to help them to change the way that they perceive it, it could have a great help for the people involved. So those 4 different areas, medication, sitting down with a psychiatrist, or using the brain stimulation therapy, I think are all great things, and that's something that each person and each individual has a different. That's why it's so hard, because it's different. You have to focus on the individual and focus on what is needed, because somebody might need all 3, somebody might need all 4, somebody might focus on just sitting down with a psychiatrist that's focusing on OCD and working with the family and creating different ways to adapt. And I think that's one of the biggest things that take off of my joy. It's interesting. My wife sat down for a little bit of watching The Aviator, and as the character of Howard Hughes was getting caught up in his OCD, she's like, wow, he's crazy. And it made me think that to somebody walking in on this situation, looking at this person for the first time, yeah, if you found this person walking and talking, repeating different things, you might do, that's your first conclusion. This man's crazy. This man is definitely something that I would not want to work with. And that's a big thing. And as a big businessman, I imagine that had a huge effects on Howard Hughes. But it shows that incorporating and surrounding yourself with the right kind of people is huge for the person that's going through OCD, so that when something happens, obsessive compulsive disorder manifests itself in the different ways that it does, those people are there to help and understand what's going on, and so don't deem him as crazy because their perspective is different. One of the sad things that I saw in the video is those Howard Hughes competition in a way used his disorder against him, or he took advantage of the different things that he was going through, and they tried to make it a crutch. And I think one of the biggest things that we can do as marriage and family therapists, we can focus on the idea of using and finding ways to still bring out the positive aspects of a person's life, because it's frustrating. It could be frustrating with what's going on in their mind and not being able to control certain aspects. So being able to walk somebody through and help somebody to interact and know that they can get through this, they have support, and it's not something that defines them, is a huge aspect. So in this regard, walking through The Aviator, definitely learned a lot about the idea of obsessive compulsive disorder and how it affects people. And I would definitely want to learn more, but I appreciate the time I have taken to learn and to go over different things, to over different treatments, and to learn more about this. But for now, we'll call that quits, and until next time, thank you.